this session, I've been super excited for. We actually did a version of this session a couple of years ago. And the speakers we have up here are amazing. And I think all of us can agree that it is super important to get out the vote this year. So we're going to be talking about their organizational initiatives, and in addition to what we as an organization will be taking on in terms of getting out the vote. So our wonderful panelists are Aliya Bhatia. She's the executive director for Vot-ER, Ben Fulgencio-Turner, who's the director of Climate for Health, and Nathaniel Stinnett, who's the founder and executive director for the Environmental Voter Project. So please join me in welcoming them.
It's such a treat to be here. I see some familiar faces and a number of new faces, so I'm really, really stoked for this. Just to get a sense of who's in the room, I'm from Georgia. Can I get my Southeast folks to just raise your hand? All right, woohoo, Southeast. Okay. Can I get my Midwest and Great Lakes folks? Just show of hands. All right, there we go. Let's do Northeast, Mid-Atlantic Northeast. All righty, very cool. Southwest, if you identify in that way. West, Pacific Northwest. All right, some folks who flew a long way to be here. That's awesome. All right. Welcome, everyone. We're so excited for today's session. It turns out that this year there are 100,000 different positions on ballots across the country. So probably where you live, there is not just one, not just the one that's going to be the most televised on TV, but many, many, many people who are on the ballot who can impact climate and health in your community. So we're just grateful to have you here. I want to start with a story about my background and how I came to Vot-ER, because unlike many of you, I'm not a health professional. I started this work actually doing most of my work in education, and I was part of a leadership program in Atlanta, my hometown, where they said, we want you to learn how the community works. We want you to go on a fire ride-along, a police ride-along, and an emergency medical services ride-along. So I show up in the dead of winter 2019. I knock on the door of the manager. His name was Scott. Scott looks me up and down and he's like, you're one of those young, idealistic kids who comes for that leadership program. All right, come on, let's take you around Atlanta. So that was my introduction to Scott. He takes me around the metro region, shows me where his EMTs and ambulances are supporting communities. And something becomes clear very quickly, which is that Scott's team is responding to things other than medical emergencies. They are often responding to homelessness. They are often responding to food insecurity. They're often responding to issues where a person had insurance that got them the medication they needed at the right price, and their new insurance doesn't, and that was becoming an emergency. Along the same ride-along, I also learned a number of other things about Scott. So Scott and I are from different generations. We have different political beliefs. We're from different parts of Metro Atlanta. I'm from a really diverse part of Metro Atlanta. He was from a really white neighborhood in Metro Atlanta. And at the end of this ride-along, I turned to Scott, and I'm like, Scott, there's so many things your team is tackling. There's got to be a way to address some of these. But I want us to prioritize. I want to pick the one that you think is the most important factor. I give you this magic wand. You get to wave it once, and then it's going to go poof. It's going to disappear. What do you do with it? And Scott's answer surprised me. He said, Aliya, if I could only do one thing, I wish all my patients would vote. If all my patients voted, our locally elected officials would invest in affordable housing. They'd keep refineries out of the backyards of my community. And when I needed to get people an ambulance, I would be able to get them one in time. So that was Scott's answer to my question about what he would do if he could only change one thing. Well, Scott understood something that so many of y'all understand, which is that absolutely we have our health-related needs. We have our social determinants of health, and these are both critically important to our work. But upstream of that are something called these structural and political determinants of health, these upstream causes of the causes. And that's what brings so many of y'all here today for this broader conversation. And one of those upstream determinants is voting. In fact, in Daniel Dawes's book, The Political Determinants of Health, he calls voting the most important of those upstream determinants. And so this year we have a really big opportunity to make an impact on one of those upstream determinants because of the many, many, many elections that are going to be on ballots this fall and throughout the summer, to be frank. But then why you? Why health professionals is the ones to actually encourage people to do that voting? And the answer lies a little bit here. There is this incredible overlap between the folks who are young, low income, and patients of color at this intersection of those who are not registered or might be registered and don't show up to vote. I'm from Georgia. 95% of our folks are registered, but not all of them show up to vote. and then those marginalized by our health systems. And this is exactly what our founder of Vot-ER, Dr. Alistair Martin, had figured out. He's an ER doctor in Boston at Mass General, and he was like, gosh, if I could support my patients to register to vote, it'd be like doing a reverse door knocking. I'm meeting them right where they're at. So I want to talk a little bit about these interconnections between voting and health, and I'll frame it. These first two examples come from more of an environmental justice lens, given the interest each of you hold in this room. And the first one is a fairly recent one around redistricting in Ohio, where the effects that we have when we draw these different districts and the different ways in which we create structures for our democracy, we can choose to either give equal voice or unequal voice. And so you see an example here of a map that in many ways was going to limit the needs of those and the voice of those who had environmental justice needs in Ohio. There's a really deep relationship between how we draw our districts, how we define who has power and voice, and what sort of changes that we can make in community and society. So how we define these districts is a critically important part of making sure our democracy runs well and that democracy produces environmentally friendly outcomes for our communities. The second example that I want to give is Southwest Detroit, which has 24 industrial sites, a 7-year lower life expectancy than the US as a whole, and asthma rates that are 2 to 3 times that of the rest of Michigan and 5 times that of the US. It turns out that this same part of Michigan is also one of the areas with the lowest turnout in the state. There are about 4,800 election precincts in Michigan. 41 of those lowest 100 precincts are in Detroit, and of those, about half are in this one tiny area of Detroit, this kind of area of Southwest Detroit. And so these communities, their voices are not being heard in ways that can create or produce political power to shift the outcomes in their communities. And the result is clear from the health outcomes that they're experiencing. And a lot of y'all I know a lot more than I do about how the placement of these different pieces might result in changes in people's health. Well, you can extrapolate from those examples out to the national level. When we look at voting and the levels of voting and the things that make it easy to vote, and we look at health outcomes, when more people vote, and in particular when people from more backgrounds vote, we see higher outcomes as it relates to health and health outcomes in our community. And you can see this in the Health and Democracy Index, which really shows a range of beautifully illustrated graphs showing this correlation. We've also now worked with the American Medical Association to make sure that this is recognized within our field of medicine and of health. In 2022, Vot-ER partnered up with the National Medical Association and the Latino Medical Student Association and built a coalition pushing this, and then also had the support of other groups like yours in pushing for this to go through. And now it is an official statement of the American Medical Association that voting is one of the determinants of health, which in turn allows y'all to take this back to your hospitals and clinics and point out to them how they can support a lot of the work of those of us who are going to be speaking on this stage today. Because it is something that is going to impact people beyond their clinical walls. How does this work? How many people here have worked on a campaign before, volunteered on a campaign before? Okay, they hand you a list to call, almost 100% likelihood that list that you were calling is people that they know have some likelihood of voting. They don't call the folks who aren't registered. They don't call the folks who aren't registered and have never voted. They call the folks who they think are going to vote, and so they want to make sure they show up and vote the way that that campaign wants. Well, who misses out? If you're not registered to vote or you don't vote frequently, you don't get a phone call. And then you're even less likely to vote the next time. You're going to hear a lot about this from Nathaniel a little bit later, but basically what we need to start making sure that we can do is support those who are seen as less likely voters to have that political voice, to register and to vote, so they become part of the cycle where now when you volunteer on your next campaign, that person on your list is somebody who otherwise may have been thought of as a low propensity voter. You're making them high propensity by reminding them within the healthcare context of the importance and power of their vote. There's also more, direct relationship of agency and power and autonomy and the benefits of voting. And so I'll just name that briefly. There's studies showing, bless you, this connection between voting and adolescent health, and the sense of higher level of personal well-being when you look at this, not just in the US, but across the world. So this direct connection between our vote and our health, and y'all in this room have the direct power to impact that. All right, y'all, it is February 2024. We are living in a country where there are hospital mergers and closures. There's industrial siting and zoning decisions being made. There are climate resiliency plans being put in place. There are laws about reproductive health being written nationally. This is one of those years where, yes, Democracy is a day in and day out thing. It is a year in and year out thing. It needs to happen all the time. But there are moments in the relay race of democracy where you need the baton to land. 2024 is a year where you need the baton to land. And over the last few years, we've seen some record turnout. We have to help sustain it, and it cannot be done without the support of the health community and health professionals like each of you. So what can you do? We're going to talk about a number of different ways to get involved with 3 different organizations here, and we want you to pick the thing that works best for you. For some of you, it's going to be something maybe that I've mentioned. For some of you, it's going to be something Ben mentions or that Nathaniel mentions. And for some of you, you're going to be like, I can do all of these things. So pick the thing that works best for you in your context. You know whether you have a leadership at your clinic that's going to be well suited to some of the bigger types of work. You know if it makes more sense to do things with other partners in your community. Only you can know what the context is that works for you. So I'm going to give you a couple options to get started, and then I'm going to hand the mic over to Nathaniel to give you a few other options as well. So the first thing I want to talk about is this right here, which is my Vot-ER badge and lanyard. The Vot-ER badge allows for people to scan it, register to vote quickly, get their mail-in ballot quickly, find their polling location, figure out what's on their ballot. Close to the election, we add the most relevant resources. If you don't yet have a Vot-ER badge, please scan the one on the left. If you have a Vot-ER badge and you're like, it's time for my department to get their badges, I've written that language for you on the right. It's a pre-written email that you can pull up, hop into a Gmail, send to the people in your department, in your community, and make sure that they get their badge. So I'll just pause for a second for you to take the QR code of whichever one of those best fits where you are. These badges will come in a couple of weeks, but in the meanwhile, you'll get training and resources and materials through your email to prepare you in other ways so that you're learning how to talk with patients about voting. You'll receive invitations to sessions to teach you how to have those conversations and to practice them live, get any of the chills out about talking about voting with patients, and go from there.
Do old badges?
Say again?
Do old badges work?
Oh, they absolutely do. Great question. All badges that are out there from Vot-ER work. The one thing I want to name is if you get a newer one, if you have an older one, the newer one you can track to your individual impact. So you can look up, hey, how am I doing with registering voters, and look at the number. That link right there, I'm going to get to see how many folks got badges because I have a personalized link. If you order the new badge, you will get a personalized link so you can see how many folks are engaging with your tools. The old badges all work. The only thing is we can't quite say to you how much impact you have made individually or whether it's tied to your institution. I'm just going to wait. Okay, cool. And then the other piece is for those of you who are like, oh, this is old news. I already have a badge. I've already spread the word in my department. For you, it might be fun. Actually, I think y'all maybe heard some of you from Peja earlier. He's actually one of our Civic Health Fellowship faculty members. Our Civic Health Fellowship is a really in-depth training 6-month component, 2 times a month. We would really love to make sure that the environmental justice community has a big part of this and that the climate justice community is a part of this. We basically provide you all the support you need to build a campaign either within your hospital or institution or even to advance the work here of the Medical Society Consortium. So the deadline for priority is March 8th. It'll start in April. It's led by one of the Nobel Peace Prize nominated activists who helped overthrow Milosevic, and is a really great way to dive in and get a lot of support for your work. And so with that, I'm going to hand it over to Nathaniel to share another set of ways to get involved, and thank you.
I totally love Vot-ER. I absolutely love it. And please, please, please get involved. It is just a tremendous organization. I am Nathaniel Stinnett, and I am the founder and executive director of the Environmental Voter Project. I come to this world and this moment in time from politics. I've run a whole bunch of political campaigns and was deeply frustrated by the fact that very, very few voters prioritized climate and environmental issues. And a whole bunch of research led me to starting an organization that's doing some interesting stuff, and hopefully you will think it is interesting too. So, in a nutshell, what we do with the Environmental Voter Project is we identify people who care about climate yet don't vote, and then we turn them into better voters. That's it. That's all we do. We don't endorse candidates. We don't lobby for particular policies. We don't even try to convince people to care more about climate or the environment. A good way to think of us is we're not in the mind-changing business. Instead, we are solely in the behavior-changing business. We are nonpartisan, and we find people who already care so deeply about climate and the environment that it's their #1 priority, yet they aren't voting, and then we turn them into better voters. That might seem like a really, really small, narrow niche to focus on, but for better or for worse, it's not nearly as small or narrow as you might imagine. Now, the reason we focus on this particular group is because one of the biggest problems, if not the biggest problem we face in the climate movement right now, is that there just aren't enough voters who care deeply about climate and environmental issues. Now, this is obviously a particular poll, but I promise you it is no different from any other poll you could find of any election anywhere at any time. Now, this particular poll was taken in battleground states in the lead up to the last midterm election. And likely voters were asked what their #1 issue priority was over all other issues. Only 4% listed climate or some other environmental issue. 4%. Now, the good news is that's about twice as much as you would have gotten back in the 2018 midterms. But this isn't nearly enough if we want to get to a point where politicians are leading on our issues. Because as Aliya mentioned, and it's such a crucially important point, campaigns and politicians and policymakers focus on the priorities of voters, not non-voters, but voters. And when only 4% of likely voters in an important national election list climate as their top priority, I'm sorry, no campaign in their right mind is going to be able to spend their time and money talking about that issue. They're just not. And here's the really important thing. And if there's just one thing that you remember from my part of this presentation today, please let it be what I'm about to say. Who you vote for is secret. But whether you vote or not is public record. Whether you vote or not is public record. And so take it from someone who's run dozens of campaigns, big or small. What do you think the first thing we do is on any campaign? We look at public voter files and we figure out, okay, who has a history of voting in the election that we're trying to win? And you better believe, with limited time and limited money, we don't waste much of it on the non-voters. Not to be creepy, but we literally know these people by name and street address. And so this is why you often hear the terminology polls of likely voters. That's who politicians care about. And if politicians are only talking to likely voters, you better believe that's the only population that they're polling. And so polls like this, and again, I promise I'm not cherry picking polls. You look at City Council for Boise, Idaho, or President of the United States, and it's going to say something very similar to this. The reason why polls like this are such bad news for the climate movement is because not only does this mean it's harder to elect climate leaders, but even when we elect the so-called right people, we all know it isn't like they can just snap their fingers and get whatever they want done, right? No, even then, they need to decide what to spend their precious political capital on, and they ain't going to spend it on something that 4% of likely voters list as a top priority. So this lack of political power is one of the biggest problems that we have in the climate movement and why this panel is so crucially important. It also gets to why we have such a narrow focus at the Environmental Voter Project. Because if you dig into these numbers, you start to see something really interesting, and that is the reason so few voters list climate as a top priority is not because too few Americans do. So instead of doing what a campaign does and only looking at likely voters, if you widen your aperture, if you step back a bit and look at, say, all registered voters or all American adults? It turns out there are tens of millions of people who care deeply about climate and the environment. So why aren't they showing up in polls like this? Well, for one pretty good reason. Environmentalists are disproportionately awful voters. Turns out that the climate movement, although we certainly have a persuasion problem and lots of persuasion issues to overcome, we may have an even bigger turnout problem. There are tens of millions of dyed-in-the-wool super environmentalists who are already registered to vote. They just don't cast their ballots on election day. A little bit over 8 million already registered super environmentalists didn't cast ballots in the 2020 presidential election, and over 13 million in the most recent midterms. And I see some of you shaking your heads in frustration, and I get it. But what I would like to suggest to you is that this is an opportunity. And I know you don't know me, but just believe me, I'm not one of these like people who finds an opportunity in every problem. I'm actually pretty cynical, but this really is an opportunity because we live in a moment in time where it's become almost impossible to change people's minds about anything, especially stuff having to do with climate change. But what this pool of people represents are people who don't need their minds changed. They're already with us. They just need their behavior changed. And I won't claim that's easy. Of course it's not easy, but it is easier and it is cheaper. And because of public voter files, it's something you can test. And so what we do at the Environmental Voter Project is just focus on these non-voting environmentalists and work with thousands of volunteers around the country delivering behavioral science-informed messaging to them to turn them into better voters. All right, before we get into how we do it and how you can be involved, I realized I just put like some big numbers in front of you. So I want one more slide just to define the size of this problem. In that previous slide that I showed you of that battleground state poll in the 22 midterms, if you drill down into specific states, you'll see two battleground states here, Nevada and Pennsylvania. These voters were asked, when choosing a candidate, what's your single most important factor? And you can see in Nevada, 5% of likely voters said climate was the single most important factor when choosing a candidate. But look at the next slide. Look at unlikely voters. Look at low propensity voters in Nevada. Twice as many of them say that climate's the #1 priority when choosing a candidate. Look at Pennsylvania, same thing there. 3% of likely voters say climate's the top priority when choosing a candidate. 7% of low propensity voters. We have a turnout problem. We have a turnout problem, but it is also an enormous opportunity. Very, very briefly, this is how we at the Environmental Voter Project work on this. And I realize I'm about to breeze through some complicated stuff here, but I want to get to Ben and then get to your questions. So forgive me if I go through something really quickly here. We can certainly address it in the Q&A. Number one, we identify these voters. We build what's called predictive models on voter files. These are the same tools that sophisticated campaigns like presidential campaigns now use to target voters. In short, the process is we will poll tens of thousands of people, isolate the ones who tell us climate's their #1 priority, and then work with data scientists to find other people like them. And it's a long iterative process, kind of like building an actuarial table if you're an insurance company. But at the end of it, what we're able to do is assign a score to every single individual voter in a state, telling us how likely they are to not just care about climate and the environment, but literally list it as their #1 priority. Then, remember what's the thing I told you that you can't forget for my presentation? Yeah, whether you vote or not is public record. So once we isolate these super environmentalists, it's pretty easy then to just get rid of the ones who are good voters and don't need help getting to the polls and just focus on the ones who don't have a history of voting. That's where we go to step 2. We've now worked with over 6,000 volunteers around the country to canvass and call and send postcards to these voters. We also do direct mail and digital ad campaigns, all with behavioral science-informed messaging that we've tested with randomized control trials, all of which are optimized to do just one thing and one thing only, and that is get these people to vote. Because remember, we've already isolated a group who has a really high likelihood of listing climate as their #1 priority. Like, you shake them awake at night and these people are going to scream climate change. And so, like, we can be completely agnostic with our messaging. We could talk about chocolate chip cookies if that's the best way to get them to the polls. And so it opens up the whole realm of behavioral science and a lot of really interesting messaging to turn these non-voters into new voters. Step 3, habit reinforcement. You don't need to be a behavioral scientist to know that it's pretty hard to change someone's habits if you only talk to them once every 4 years when there's a presidential election going on. And so we take every election seriously. We treat every election, even library trustee races and dog catcher races, as a precious behavioral intervention opportunity to turn these non-voters into new voters. 1, because voting is potentially habitual. And 2, what's the thing you're not allowed to forget? Whether you vote or not is public record. You get someone to vote even in a dinky city council race, within a few months, it's on public voter files for every candidate and campaign to see. And believe me, once they see that, they start polling those people to figure out what issues they care about, and the cavalry comes in to mobilize them. So that step 4, ultimately, we change the electorate. Because even in this hyper-partisan environment, there is still one thing that all Democrats and Republicans can agree on, and that is, boy, do they both really like winning elections. And if you can dramatically increase the number of environmentalists who vote, not the non-voters, but who vote, politicians will follow. Not out of the goodness of their heart, but because of the brutal arithmetic of democracy. Like, either you get enough votes or you don't get to be a politician anymore. Very, very briefly, just over the last 3.5 years, I don't need to explain randomized control trials to a bunch of scientists and medical professionals, but we have just in 3.5 years mobilized voters in over 900 elections. Many of them were very small, so we couldn't get statistically significant results, proving our turnout while controlling for outside variables. But in many of them, we could. And using this behavioral science-informed messaging and this precise approach, we were able to increase turnout in 2020, 21, 22, 23. We increased turnout in general elections as much as 1.8 percentage points, in statewide primaries as much as 3.6, and in local elections as much as 5 percentage points. These might not seem like large numbers to you, but in politics, they are everything. The second metric we use is over the long term. Since we launched a proof of concept in 2015, we have now communicated with 9.5 million voters, all of whom were registered to vote, listed climate as a top priority, but were unlikely to cast a ballot or else we wouldn't have been talking to them. As of about 10 months ago, almost 1.5 million of them had become such consistent voters that they had voted in their most recent federal election, state election, and even local election. This is what constant communication about becoming a better voter can achieve. Now, to be clear, this second metric isn't a randomized control trial. We can't claim that we're solely responsible for turning 1.5 million non-voters into super voters. But there's no other organization that's been mobilizing voters for now almost 2,000 elections in the last 7 years. This is what repetition gives you. I'm going to hand it over to Ben in a second. This year, we are working in 19 states. We have already identified 4.8 million registered voters who have a high likelihood of listing climate or other environmental issues as their top priority, yet they haven't voted in a single election since before 2020. So they skipped the 2020 presidential and haven't voted since then. So we need to assume that they are unlikely to vote again this fall. We have a whole bunch in a whole bunch of important states. I'm not going to read through these because I'm going over, but it isn't like these are all in one state and not in the other. These are some enormous opportunities to make a difference, and you can volunteer from wherever you are. So If you would like to join us to call voters, I'm going to give you a QR code in the next slide, but it's on environmentalvoter.org. You can sign up for a phone bank, get trained right at the beginning. Once you're trained, you can call these voters whenever you want. We are giving you proven scripts. We never ask a volunteer to do anything unless we have proven in a randomized control trial that it increases turnout with statistically significant results compared to our control group. Similarly, we are currently canvassing voters in Pittsburgh, Tucson, and Austin. Pretty soon we will be adding Philadelphia. If you would like to canvass voters with proven scripts, we'd love to have you. We would also love to have you send postcards to voters. Here's that QR code I mentioned. Please go to our website, sign up. And if you're one of those people who thinks, oh, I don't know, I don't like talking to strangers or don't like calling voters, don't worry. I am like the waspiest person in the world. I don't like talking to strangers either. But what I can tell you is that when you do this, almost immediately you'll realize it's a lot easier than you think. And you know what? If after a few minutes you don't like it, stop. No one's forcing you to do it, but you're here for a reason. You're in this room for a reason, because you care deeply about the climate crisis, you care deeply about its health impacts, and you recognize the importance of the next 9 months. So please, please join us. Thank you very much. And you are in for a treat with Ben here.
Great. Thank you so much, Nathaniel. So I've been thinking a lot over the last day, ever since I heard that discussion of anxiety and coping mechanisms from yesterday around children's response to climate change and how that is reflected. So I'm just curious, who in here is anxious or feels anxiety about the 2024 elections? Yeah. And so it really has me thinking about, what is my coping strategy for this? How do I make sure that it doesn't just make me feel good and get me out of a spiral, but also is productive and is part of that collective action? And so I think that's really how I'm trying to think about this. The same way that I'm approaching growing anxiety about climate change is look for ways to get involved in ways that are collective, that are productive, that help to scratch that anxiety in a healthy way. Same thing with this 2024 election. So I hope that I know that my other reactions are to turn away or to negotiate and bargain and tell myself why it might be okay. But taking these kinds of actions are the way to actually be productive and feel a little bit better, we hope. I'm Ben Fulgencio-Turner. I direct the Climate for Health program at Eco America. And so we are another nonpartisan, nonprofit organization. We work across the country to drive the social movement for climate solutions and climate action. So I direct the Climate for Health program, which is aimed at the health sector. We also have a faith program. We have a communities program. Throughout all of these, we want to engage people who are trusted in their communities with clear messages and ways and scaffolding to start being a clear, present, visible voice for climate solutions in ways that resonate with people's values and help them make the connection between things they already care about with climate action and climate solutions, and draw them into that collective action so they're not in a state of denial or negotiation or other unhealthy coping mechanisms, but are part of that productive movement forward. So I hope everyone here who's taken the time to be here knows this, believes this deep down in your bones. The health voice is incredibly important, that health professionals really drive action. So I'm going to go through a couple charts. I'm going to go through this fast because there's better research every day coming out of the Center for Climate Communications on a lot of this, and you've already heard a lot of this. But first off, I'm sure this has been said multiple times over the last 2 days. Health professionals are the most trusted profession in the US. This is consistent, even after COVID, even after the campaigns against it. Nurses and docs are up there higher than anybody else. Not really a contest. So the other piece, I think I've heard this mentioned before, is that when you ask people, the general public, how concerned are you about climate change? The plurality response is very concerned. When you ask people how concerned are others around you, the concern number drops from 75% to less than half, and that plurality number drops to the lowest answer, from 45% to 14%. Think that others around them are concerned about climate change. So this is called pluralistic ignorance. It affects your behavior. Thinking that you are alone, that you are going to get pushback and resistance, means that you're going to be quiet about it. And the reason I think of this as a good news graph is because the solution is so straightforward. Talk about it. You are going to be pushing on open doors. Like it's likely that people are at least somewhat concerned about climate change, and you breaking this cycle for yourself helps them to break it as well. And so just emphasizing that even if you feel like you are alone, you are not. It's not just the people in this room. And talking about climate change helps others break out of that paralysis of feeling alone and empty and frustrated. And then the final good news chart is that health is what motivates people to take action on climate change. So this really, again, we know that the health voice matters. I just want to emphasize again and again that bringing the health frame to the discussion of climate change, to the discussion of voting, to the discussion of just about anything, motivates people to take action, motivates them to join you in those collective, constructive responses to a very stressful thing. Like, it is logical to be stressed and anxious about these problems, and offering ways that the people can understand that their values, that the things that they care most deeply about are connected with the actions and solutions you're bringing forward. And so, so all of our programs, we've focused on, got some nice little number jumping, but we've trained thousands of people on best practices on providing this kinds of messages, and got thousands of them to commit to taking actions and engaging with people. And in 2024, one of the core ways we want to get this network of folks who are committed and trained is to get them focused on getting out the vote, communicating to others on the importance of voting, and providing tools to get people to the polls consistently over and over again. And we really developed this just thinking about the folks that we have trained, our kind of internal network of ambassadors through our health program, our faith program, and our communities program. But then as I started talking, and obviously we're not going to recreate the wheel. We are looking at the other tools that are out there for how to get people engaged. And we want to make sure that other people can use the engagement tools that we have, the schedules, the resources that we're developing to connect their network. So we really want to make sure that anyone can use this to build their network, to get others involved, and to build this as part of their climate engagement, is getting out the vote. So just as we want you to make a habit as a health professional of talking about climate change in as many contexts and as many situations as you can, part of that in 2024 that is inescapably important is voting. So just a few pieces. Obviously, we are here in February. The election's not till November. If we wait until October to get started, we all know that is a bad idea, that we need to get started right away. So I think everyone here understands local races matter, primaries matter, that there are chances to vote in meaningful elections, extremely meaningful elections in the coming months. It's not just about November. So getting educated about what's happening in your districts, in the districts of your friends, families, patients, community, and colleagues, and helping to communicate them the importance of getting out and voting is critical in the coming months, starting yesterday. And then, yeah, I have the dumbed down version of the reinforcing commitments that Nathaniel mentioned, that the more you vote, the more you vote, that getting started voting, even talking about voting, being public, being visible about this, has an effect on people. It makes you more likely to vote just by talking about it, saying you're going to do it, putting out a yard sign, phone banking for somebody else, even voting in a primary election. You are a lot more likely to vote in a general election if you do any or all of those things. So really getting people in the habit now to start taking those actions around voting, around expressing their commitment to vote, and recruiting others to vote is really important to making sure that they vote. And so we want, again, really important to continue to push this through. And then again, I don't have to tell health professionals this. Everyone knows about patient compliance as a possible dirty set of words, but persuading people to change their behaviors, to do more, it takes multiple touches. It's not just a single conversation. It's not just a single framing. It is lots and lots of times from different people in different contexts, the importance of voting and resources to go ahead and get started. So we really had these ideas in mind as we were building out our plans for 2024 and build out our campaign, which we're calling Election Earth. So the focus is on how this election is critical, as all elections are, to protecting our climate and to having a healthy future and a healthy present. So we have themes for each month of the year that we've built out through the year that include action items that you can take, framing around other issues and values that people hold dear, making the connection to climate. And again, this is built not just for our health professionals, but also for our faith communities and other ambassador groups. And so throughout all of this, we're going to be pulling in the resources from the Environmental Voter Project, from Vot-ER, to get people out to, here's a way that you can engage in a phone banking project, get your Vot-ER badge and start registering patients or even colleagues and community members, and really making this, giving people multiple entry points to get started. Our core audience here are people who care about climate change, are engaged with us, or engaged in our networks, and we want them to get started taking action, being a really strong public visible voice with the focus around voting. And so we really want to just offer people as many entry points as possible, and then scaffolding to keep on building from there. You know, the most effective exercise routine that you can have is the one that you're actually going to do. It doesn't matter how efficient that brutal workout is that has you doing 1,000 sit-ups in 15 minutes. You do it once, you're probably never going to do it again unless you're a special type of person. But doing the thing that you are actually going to do and building from there is how you grow, how you build a routine, and how you build behaviors. And so we really built this entire campaign around inviting people in and giving them ways to continue to grow and share. And so I'm just sharing a little bit more of the details on this, that we have resources for each month where we have a focus on providing resources on what you can learn about the themes for that month, whether it is Justice and Black History Month, and then moving on to taking action, again, focused on things that increase awareness, increase turnout, increase visible commitments for as many people as possible. And then we do want to track it. We want to share the impacts, share the facts that people are working on this, and spread to more people. And so, like I said, we really developed this thinking internally, thinking about our set of people that we've trained and engaged, and we want to offer this out to as many people as possible to use these tools. We'll be having social toolkits each month that we can share with you that are open, you know, where you're not going to hurt our feelings if you edit the social toolkits for your newsletters, make changes and roll these out. Or if you, again, we want this to be accessible and have entry points. If there's just one month that you're especially interested in, one set of themes, one set of actions, if we have something that we've built that is helpful for you to roll that out, and you just want to use that one, that is fine too. We really just want to get people to get started using this and to roll out the impact as broadly as possible. So right now, I do not have a QR code or a landing page to sign up for this, right? I'm doing it the old-fashioned way. Just email me. It is the easiest email address I have ever had professionally. It's just ben@Equal America. So you can go ahead and just shoot me an email if you want to join in this. We're building out a full network. We'll have a few optional calls to engage on this, but for the most part, we just want to share the resources out with you so you can get them onto your listservs. And again, not just health. If you are part of a faith denomination and you want to get this in that newsletter, if your community center has things going out around opportunities to engage and take action, and you want to use some of this there on their social feed. People have full lives, and climate and health and the voting are relevant to all aspects of those lives. Also, we do offer trainings if you want to get more people from your colleagues to join in this work, to get connected, to get over the hump of saying, I'm not an expert on climate change, so I can't talk about it. Which I feel like the more letters you have after your name, the more likely you are to spout that kind of line. You don't need to be an expert to talk about climate change. If you know what the impacts are, you know enough to know what we should be doing next. And so that's really our training is free, 3 units of CE for free, and helps people get over that hump and give them ways to get started engaging. We have lots of other stuff at climateforhealth.org. I'm here. I'm happy to answer any more questions and share resources. And again, I have my email again here. If you don't get a chance to talk to me today, please feel free to email me. I'd love to connect and talk more. Thank you.
This question is from our virtual audience, and it's for Aliya. Do you have any advice for getting buy-in from an institution to allow clinicians to wear badges?
Fantastic question. First thing I will say is Epic is actually incorporating Vot-ER into the way that they.
That's great.
I think I think if Epic is going to incorporate it, that should give some indication to leadership that it is a perfectly like normal thing to do. So just, sharing that, for example, Epic, the American Medical Association, the American College of Physicians put out a policy memo over the holiday that was like, here are the 5 reasons the health space should be involved in this. So we have those levels of support. I was just talking with Lisa right before we started. On our site at Vot-ER.org/resources, we have a set of resources, including one-pager presentation you can give to leadership, all of the legal guidance and legal support for the work that we do, and downloading that and sending it in an email to those folks. I also want to share in this room the story of what happened at Children's Hospital of Philadelphia in 2020, because I think it's a helpful example. We had an incredible pediatric ER doctor, and she, in early 2020, was like, I really want to do Vot-ER stuff. So she goes to her administration, and they're tepidly excited, but they don't want to put their logo on our materials just yet. And then a bunch of people show up over the summer with Vot-ER badges, and we get a call back from the Children's Hospital of Philadelphia, and they say, can you please put our logo all over the materials? We really want to be an official supporter. And so I just named that one thing that individual folks coming in with badges helps do is say, this is something that we support and we want to be a part of the movement. So I think it's both you want to bake the pie from the top and the bottom, right? You want to reach out to leadership, share with them the materials, present to them and whatnot. And you also want to make sure it's not just you doing it. Get a team together, be part of the fellowship to learn how to build a campaign and get lots of folks involved in it.
And I'll just add that that's a great activity for a green team or sustainability team as something to do in this election. If you already have people who are committed and working together and pestering administration, one more thing on the to-do list. Yeah.
Absolutely.
Hi, everybody. Thanks for the really inspiring presentations. I did the Climate for Health Ambassador training and I highly recommend it. It was really great. My question for everyone is, how are your efforts coordinating with the maybe efforts of other groups to register voters who are turning 18 between now and Election Day?
I'm happy to start on this one. The largest proportion of Vot-ER, the kind of plurality of Vot-ER participants are pediatricians and OBGYNs. Who are seeing a lot of younger folks. And the beauty of engaging in this work as somebody who treats adolescents or treats young folks who are turning 18 is there doesn't need to be an election coming up to have an occasion to ask. Oh, you're 18 now? Here's our normal list of questions. Oh, by the way, I have one more question for you because now you're 18. You have a new type of power and a new way to influence communities around you to ensure your health. Are you registered to vote? Oh, you're not? Here's my Vot-ER badge. Go ahead and get registered to vote so that you're voting in the upcoming elections. Doesn't matter if there's an election coming up. It's just the fact they turned 18 becomes the trigger to have that conversation. So we're doing a lot of work in that way and really appreciate your question. I'll look it to Nathaniel or Ben for more.
Yeah, my answer is easy. We don't register voters. Voter registration is crucially important, but a lot of people don't realize that there are maybe 3 times as many people who are already registered yet never vote. So 160 million people voted in the 2020 presidential. We have 221 million registered voters. So that's about 60 million. Between the 221 registered voters, we have maybe 244 million eligible voters. And so, oh my gosh, is voter registration important? Because unless you're registered, you can't do any of the other stuff. But we actually don't even jump into the game until these people are registered.
And then for our campaign, I think that the only thing I would add is that we are looking not specifically at folks who are turning 18 between now and the election, but at cross-generational conversations, asking people, do your kids, do your grandkids, do their friends, have they registered to vote? Do they have a voting plan? Do they know, if they are registered, are they planning to vote? And do they know when the deadlines are, when early voting is, the mail-in process? So setting up some scripts and campaigns for kind of what we assume will be our core target audience of mostly professionals who are a little older than 18, and then a fair number of professors and retirees are part of our networks, and faith leaders. And so working through those as messengers for that. Yeah.
Great presentation.
Oh, mic's off.
This one's on.
Oh, thank you so much. Thank you for your patience as we work through this. All I wanted to say is actually my question is answered. However, I do want to emphasize, first of all, thank you very much for all those wonderful presentations and the answer you gave to the earlier question about youth engagement. And that was going to be my question, but not specifically just, folks that are turning 18 and how do we get them to vote? But I think Ben addressed it slightly, is we really need to engage them way before. And, talking about our passion regarding climate change and other environmental issues. And we know that young people care a lot more than maybe older people about climate change and their future. And we talked about during my session yesterday and throughout about their climate anxiety and how taking steps for climate solutions will help them, with their mental well-being. I just would like to encourage us to be a little bit more creative and active and do a lot more to engage the youth, not only try to catch them when they turn 18, but working with them and have them understand the importance of voting. And I just want to, again, emphasize that, this group of you are so creative, so amazing. Why can't we just find a way to engage the youth in a really huge way between now and the elections? Because we have so much at stake. Thank you so much.
I think I might just add to it, kind of doubling down on the importance of engaging youth, is that we do know that, some of one of the strongest ways to persuade people and change their minds on their behaviors is their children talking to them. That intergenerational conversation coming up from the bottom really persuades adults, especially, I've seen, I can't quote the study, but especially conservative white men are extremely influenced by their children, more than any other group. They might not be as, the magnitude might not be as much as we would like, but there is a real impact from children talking to their parents and can change their behavior. So reaching out to them as this is another way to engage them in this collective action of driving change from their parents is another way to bring people in.
Well, thank you. Just fantastic talk. And I have to state that with all the efforts throughout this country to disenfranchise voters, it is really refreshing to see you folks doing the exact opposite, and I applaud you for that. So my question is, where do you guys get your funding, and how do I take this to the state, to the folks that I work with, in order to be able to apply, and maybe not to compete with your folks for funding, but in order to accomplish some similar pro-voting efforts? Thank you.
So I can start. So we at the Environmental Voter Project get our funding from donors like you. We got, I think, over 8,000 individual donations last year. That's how we are funded. We do not get funding from foundations. We are what's called a 501c4 nonprofit, because when you identify people based on an issue they prioritize and then get them to vote, that's viewed as a type of grassroots advocacy. So individual funders is how we do it. And as far as how you can try to duplicate our efforts, I think a few things are important to bear in mind. First, persuasion messaging or mind-changing messaging is very different from behavior change messaging. Should always try to be really clear. Is this target audience, whether it's a person or a group of people, someone whose mind I'm trying to change, I'm trying to get them to care more about climate, or am I trying to change their behavior, right? Get them to eat healthier, exercise more often, or vote more often. If it's the second one, if it's trying to get them to vote more often, what all of our research shows, and we certainly stand on the giants of behavioral psychologists and sociologists and economists, is you probably shouldn't try to rationally convince them of the importance of voting. And I know that's hard to hear. I know we're all like children of the Enlightenment. And we like to think that like all you need to do is have a conversation and convince someone that it's important to vote. But time and again, the messaging that works best on behavior change, not on mind changing, but on behavior change, treats people as social animals rather than rational animals. And so usually what you're trying to do, and both Aliya and Ben alluded to this in both of their presentations, is figure out what kind of people are they, and perhaps more importantly, how do they want to be viewed by their peers? Do they want to be thought of as an honest person who keeps their promises? Well, then maybe you should get them to sign a postcard to say that they're going to do something, like I know that Lisa was mentioning, and then follow up with them a few weeks later and say, hey, just want to remind you, you said you were going to do X, and we know it's important to you to be an honest person who keeps his promises. This is the kind of stuff that dramatically increases people's behavior change. One thing that we do with the Environmental Voter Project that people always find really weird is we never talk about the environment. Not because we don't like talking about climate, we love talking about it. It's actually just not that good when it comes to getting people to vote. Instead, things like Ben was mentioning, plan making, get people to think through the plan of how they are going to vote. Morning, afternoon, evening. Is it going to be an early ballot, a mail ballot? Do you know where your polling place is? Things like that are usually the best messages. And whether you start another organization or just do it in your little peer group, these are things that are so easy to replicate, and they can work wonders.
Yeah. Vot-ER it's a mixture. So it's both folks like y'all who can contribute individually. We are a nonpartisan 501c3 organization, and that is so that we can partner directly with the clinics and hospitals that many of you work with. That is something that's very important to them, so we make it important to us. We have a bipartisan advisory council. We work with secretaries of state who are both Democrat and Republican in our work. So that's a little bit about how we choose to fund the work so that we can continue to partner with the types of major organizations that we want to partner with. One thing I will name, is anyone here working in a community health center or adjacent to community health centers? All right, we just opened up our community health center program. We can provide some funding between $5,000 and $10,000 for the year to support your efforts to implement voter engagement and voter registration efforts. And so if you are looking for funding for a project like that, the deadline is March 11th to apply for Vot-ER's Community Civic Engagement Program, which you'll find it on our Vot-ER site. And then the last thing I will name to build on what Nathaniel just mentioned is at Vot-ER, part of why we want people to use resources like the Vot-ER landing page. Once they do, we then get folks like y'all to come help phone bank those folks and make sure that they actually show up to vote. So if you're working with folks who have a choice about what they do, something that allows follow-up, something that gives you enough data to be able to follow up is what we would suggest in terms of implementation. Because if it's just a person who registers, that's still super important. But if we can't track them through all the way to voting, it doesn't give us as much leverage to be able to ensure that behavior change. So that's the piece that I'll name there.
Great. No, yeah, I'll close out. So Eco America, another C3 funded by a mix of donations and some foundation grants. And yeah, our whole theory of change is to ask people to replicate what we're doing. We offer editable and customizable PowerPoint decks for giving talks about climate and health. For all of these tools that I mentioned, we want people to use these, tweak them, use them in their communities. So any way that we can support you in using these tools and building it out, happy to support you in any way we can.
Last thing, quick thing I'll say is look out for action items from us from the consortium in terms of how to get involved with Vot-ER and with Environmental Voter Project. And we'll also be sharing the resources for Eco America. So thanks to our wonderful panelists